This is the Healthcare Marketplace Specialization, Healthcare Marketplace Overview. I'm Steve Parenti, and this is Module 5.2.1, Goals of Health Information Technology. So, health information technology is something that's been talked about for a while, but let's first of all by talking about what is or are the goals of information technology in general. One could argue it's to make your life a lot easier to obtain products and services. You go online, whether it be Amazon or any application you want. It can improve your quality of life. You don't spend as much time, say, waiting online. You can buy things quicker. It could save you money. There's some labor savings when you have lots of computers putting in sort of tedious data in and checking on that information. And there could be less costly mistakes because you can verify things more easily with technology. One of the more interesting parts of it, though, is that you can make money. It is much more focused marketing, either through data analytics or just information that's revealed to people from information technology. So let's talk about some of these. There's a great body of research that's been written by Eric Burleson and Lauren Hitt from the MIT School. Lauren Hitt's gone on to Wharton. What they've done is talk about the economic theory of information technology, and the thing that they highlight are three different measures of IT's value. That is productivity, profit, and consumer welfare. So let's talk about each one of those. One of the things that they first postulate is that one of the unique features of IT is that there's an assumption made that information technology cannot yield profits, it only reduces costs. Now, this assumption, however, is not true if an industry, such as healthcare, has high barriers to entry. If nothing else, from the modules we've gone through so far, we know that there are barriers to entry. Physicians have to be licensed. You can't just put up a hospital anywhere. You can't just set up your own insurance company easily. Those are all basically barriers to entry. So since healthcare has many barriers to entry, providers and insurers should buy IT not just as a tool to control costs, but potentially to profit as well. So let's talk first about productivity. How would that apply? That's usually thought about in terms of statistics and economics, which is otherwise known as econometrics. And so what we do in this space is we define, first of all, an output in healthcare. The easiest one to define is mortality, dead or alive, 0 or 1. And so in this instance, we can look to see, did you essentially avoid an unnecessary death? That's one of the most basic ways you can look for productivity. A more nicer one, if nothing else, is looking for improved outcomes. However, this can be highly subjective. How do you really know that you're feeling healthier? We don't really have little microbes in us or something that would really say, or probes, I should say, that give us a good sense of whether or not we're instantaneously better. Like my score is now 70 out of 100. Now today it's now 72. We'd like to do that, but we're just not there yet, whereas mortality is pretty much undisputed. How do we look at this in terms of outputs to inputs? We first of all need to also define an input. And what are those things? The most easy thing is like, what's your investment in IT? Is it workstations? Is it iPads for physicians? Is it mobile phones with GPS tracking? What are you actually putting in there? Are there RFID tags? And then the other thing, obviously, is labor. You want to have that because you want to see the trade-off between the labor savings that IT can give you in terms of your productivity boost, since labor is extremely expensive in healthcare. Second application is profitability. And as we said, since we have low barriers to entry, we can have profits from IT. What we can look at is some research I've done early on. It shows that hospitals who invested in IT can improve their profit margins by as much as 40%. Now, that's a 40% change. What that means is that they basically went from, say, a profit margin of maybe 2.4% to a profit margin of 4%, which is still pretty healthy, but it's not nearly the profit margins you might see in sort of some very lucrative technology, say in energy or maybe even medical devices. So this study was refined later to see what really drove things. Well, the interesting thing about the study is what we actually saw was that it wasn't actually the hospitals who invested in IT that were doing much better. It was the hospitals that were very wealthy because they actually had a lot of assets and were able to buy IT, and that's actually what led them to be able to prove that result. So it was a reverse causality problem. So this actually shows what I'm getting at. These are the actual hospitals over a period of time. It showed that the hospitals that invested in information technology did better than ones that did not. The difference, though, is that we looked at total margin and not operating margin. When we actually looked at operating margin, turns out these things were flat, that there really was no difference whatsoever. And that was our tip-off that maybe this really didn't have anything to do with the fact that the hospitals invested. It was just that the hospitals who had additional assets from, say, stocks that were donated to the hospital or land or other acquisitions, they were able to buy the IT, and that's why you actually had that story. And then finally, consumer surplus. Consumer surplus is always one of those concepts in economics. It's a little bit challenging to understand, but it really matters a lot in IT. The idea is that it's derived by consumers who are willing to pay a market price, or actually get the technology for a market price much lower than what they would have been willing to pay if they had to pay it out of their pocket. So, for example, back in the day when I wrote research papers as an undergraduate, a lot of times we had to go to this thing called the library and go to these things called stacks and find journals and copy them on copy machines, and ultimately plow through lots of books to figure out what's going on, as opposed to today where you can pretty much Google most of what you're looking for and never go to the library actually. And but as far as a consumer, starving student living on macaroni and cheese, I was clearly willing to shell out maybe $500 or $600 a year just in copying costs and time costs to go do that. Whereas today the time cost is pretty negligible thanks to Google, and actually I don't even have to print anything out. So much different. Lots of examples of this. The PC market today, there's so many things that computers can do for us that we otherwise previously took for granted. And so when we want to get a sense of how big that surplus is, we sort of usually plot a graph that looks at where the price point is for a given service and what we would have been willing to pay, and all the additional value we got because someone else was willing to develop that technology at a much higher price point, and we get that value back from consumer surplus. IT is littered with this. This concludes this module on health information technologies and impact in the healthcare marketplace.